Our special guest today is Dr. Gerald Dorros, a good friend of mine and one of the legends and luminaries in endovascular medicine. Jerry, thank you very much for accepting the invitation to join us for this podcast.
My pleasure, Sanko. My pleasure.
So to start this conversation and reminisce about the history of endovascular medicine, I would like to start with your early beginnings. So I would like to know, what were the key moments in your early education that influenced you to become a physician?
When I was at the Bronx High School of Science in the sophomore year, they had a work day and they took me to the hospital of special surgery. I had no idea of doing anything and walked around the ward with them and only looked at children who were in body casts to correct kyphos scoliosis. And I just said, there had to be a better way. And that remained with me forever.
Very interesting. So, Jerry, your path to cardiology was very circuitous, and I know quite a bit about it. Your initial medical profession was in obstetrics and gynecology. So when and how did you decide to change your specialty and to become a cardiologist?
When I went into medical school, in my last years, I was with Dr. George Kleiner, who helped me in OBGYN. I had good hands, and I learned to deliver babies and repair things as a medical student. And so he helped me, but I wanted to do medicine as well. And so I did a year of OBGYN, then I did a year of medicine, became eligible, and then went into the service and was an OBGYN perinatologist before that subspecialty existed in Frankfurt, Germany. But I really did not enjoy taking care of healthy women. And sick women, that was fine, but healthy women, I just didn't enjoy that, and went back to Boston to do cardiology, being board eligible in OBGYN, certified in medicine, and then started with Bill Hood at Boston City.
Very good. So I believe we first met in Houston at Texas Heart Institute in 1978. Is that correct?
Actually, no, it's probably around when we came back, earlier than that, because I came in the summer of 75, 76 to Houston to work with Dr. Matur and Dr. Hood, Dr. Hall and Garcia. And that's when we met. I was with a guy named Masakio Terasawa, and we were on the Hood, the Hall Garcia service, and that's when we first met.
Okay, so our friendship goes back for 50 years. That is absolutely amazing. So what was the reason that actually you came to Texas Heart Institute?
After I finished my training at Boston City and Boston University, I told Bill Hood I really didn't know how to catheterize patients. There was only angiography. And so he arranged for me to come down gratis. I did get a white coat, but gratis, and worked for 4 months on the Hall and Garcia and Matur service. But the most important thing was that Dr. Matur was one of the people who changed my life, because Dr. Hall, Texas Heart had the patients coming from the Netherlands for bypass surgery for Dr. Cooley, and somebody had to read the angiograms. And I read the angiograms, and then he went over every angiogram with me, and we had to make a diagram. And then I realized that I had a better understanding when I saw on the IV pole my diagram, and that Dr. Cooley was operating from that diagram on these patients.
Interesting. I remember, Jerry, we actually did several cases together in the cath lab, and you were trying to learn Sohn's technique with brachial cut down, And I already, as a fellow, had plenty of expertise. I would do 7 or 8 diagnostic angiograms using a cut-down and Son's technique. So I had a pleasure to teach you how to do this procedure, even though you were a surgeon before that. But anyhow, that is history.
That is history, and it was very important for Dr. Matur to teach me and to make me commit to what I saw on paper. And I did that for the rest of my days. Every angiogram I ever saw, whether it was in the United States or overseas, had a diagram.
So the next thing is we're going back through your history of endovascular medicine. What role did Simon Sturzer had for you in getting involved in coronary interventions?
Well, when I heard about this, we went to the Mayo Clinic and listened to Richard Myler give a lecture in August of 1977. I thought this was really cool. We took a patient subsequently to San Francisco, and because I had surgical experience, he asked me to scrub in, and I helped. But I said this Eindruck machine that blew up the balloons was just antiquated with these 2 cylinders. And I worked with Donald Spring to create and actually patent a handheld device had a syringe, a 5cc syringe, to create the pressure. When Simon saw me in November at the American Heart, he said, "You just stay with me and I will take care of you." And he actually did. I was young. He was older. He was senior. I was very junior.
I see. I heard from you way back. I don't know if this is correct, but I heard that actually the way you heard about Simon Sturzer is that your father called you from New York, and you said, "Listen, we just saw on TV Simon Sturzer said that there is a new technique or technology available for coronary angioplasty. You need to know about it." Is that correct?
That's true. That's true. It was, as Simon describes it, was a quiet evening on news. And instead of having a 25-second, he was on the news for 4 minutes. My father saw this. He told me about it. And I went to the Mayo Clinic, just having gone to Milwaukee. So it was really by chance that it started.
So it's interesting, actually, that our paths crossed many times, because before I came to Chicago, where I was trained at Northwestern, and then to Texas Heart, I started my career in Milwaukee, where you ended up right after you left from Texas Heart Institute. You joined and practiced the same individual that I was with when I was in Milwaukee, and then also at the St. Luke's Hospital in Milwaukee, where you were after that, before you actually left Milwaukee. So our paths crossed many, many times. But I wanted to also to mention and to thank you, because we are very, very appreciative. You went to Switzerland to Andreas Grunzig meeting shortly after you left Texas Heart Institute and went to Milwaukee. And then within a short period of time, you came back to our institution, the Texas Heart Institute, to teach us how to do coronary angioplasty, which is absolutely amazing and rewarding for us that a former trainee from our institution would contribute so much to our education as well.
You can imagine what it was like giving the lecture and seeing Dr. Cooley sitting there in the first row and smiling. And I never understood at the time whether he was laughing at me or just smiling and said, "This is the future." Subsequently, at my home in Jackson, he came and he said I was smiling because this is the future.
So tell us a little bit more. How did you meet Andreas Grunzig?
It's a kind of strange story because I decided to go to the second meeting and went to Switzerland and to the Catheter-Based and met Andreas there. But I was very, very junior to everybody else who was there. And so Andreas really was not happy with this young guy who was not in a medical school situation. He was at Lutheran Hospital in Milwaukee, and he was doing cases. But he did help me get the equipment, and we brought it back to the United States through customs without any problems because the customs officer said that his father had just died from a heart attack. And that's what happened. But Andreas was a little bit unhappy about the fact that I was doing a lot of cases and that the other people, whether they were Duke or Harvard, Yale, no one was doing anything. And so in the United States, it was Simon, myself, and Richard Myler in 3 parts of the country.
Excellent. So you kind of covered a little bit this topic, but in the early beginnings of coronary angioplasty, the equipment was very primitive. And you actually did a lot of work on designing a better product than what existed with the first Grunzig balloon, the inflation device, guiding catheter, and so on. So can you mention a little bit about that contribution of yours?
It goes back to what you said before, was that I learned how to do the brachial technique. It was very helpful because no one else did that apart from Simon Sturzer. So we worked with Cook, and we got Bill Cook to help us to make these, but they were non-steerable, but we used a modification of an Amplatz catheter to cannulate the coronary artery, which was the most difficult to do at the time. And at the time, there were no arterial sheaths. So you had all of this bleeding from the femoral artery, but the brachial artery we could control. And so that was the beginning of us helping to do the right coronary, which sounds silly today, but it's really the right coronary helped us use the brachial technique.
And actually, we published using your guiding catheters, left brachial approach for right coronary angioplasty, and those catheters were really good. I remember they were black or kind of grayish black in design. Right, exactly. But you had several curves made that really fitted well. Well, the right coronary was easier, but the left coronary was a challenge from the very beginning. But you also have an inflation device that you designed. Can you mention a little bit about it?
We just thought that the inflation device was just pressure, and we said, why do you need all of these big things? So it looks like a gun where you just had a cartridge, which was a 5cc syringe. You put fluid in there, and then you could just turn the valve that advanced the syringe, advanced the syringe, and created pressure to blow up the balloon, and it deflated. We actually sold a few, but I didn't realize you're supposed to really guard your patent, and but I never did anything with that.
Well, it was interesting because you gave us some of them, and we used them from the very beginning. This was a heavy metal gun-looking type of a device, and it would inflate instantaneously, which we would never do at the present time. It was almost like explosive inflation of a balloon, right?
It's true that those moments when I listened to Richard Myler, I woke up that night at the Kaler Hotel, and I was thinking, and it was crazy thought I had, which was that I was going to fix a thoracoabdominal aneurysm. I had no idea what I was talking about, but this is what I did. And in 1993, I actually did one with Juan Perotti's La Tecra device. So that was the beginning. That was my start. But there were people who helped me along the way.
So let's move to another area, because you had so many areas of interest. and so many contributions to endovascular medicine. You started very early in carotid artery interventions. So how did you start in that, and who were your leaders or contributors or legends that inspired you to move in that direction?
I would like to tell you that there were, but at the time I had been doing many, many peripheral procedures, whether it was renal and brachial and subclavian artery stenosis and below knee. And at that time, there was a patient, I'm not supposed to use names, but a patient who had bilateral carotid stenosis, was in the 80s, had severe aortic stenosis, and was refused surgery multiple times, twice by the same surgeon and once by a different surgeon. So the TIAs were there. They asked me if I could do this, open this up. And I said that the difference in carotid versus coronary wasn't pressure determined, it was embolic determined. And if you opened up the artery, as we knew from coronaries, it would heal, maybe the ulceration and the plaque wouldn't fall off. So I took the patient to the cath lab. And as the patient was on the table being prepped, the surgeon came in and wrote in big across this patient is now a candidate for surgery. We went on, I used coronary balloons, a 4 millimeter coronary balloon, and opened up the vessel. The TIAs went away, but I was silly enough to bring the patient back and use a larger balloon, no distal protection over a guide wire. It was a different time. And it was the Klaus Matthias. He said to me, that was pretty cool, but that was a long time ago.
So one of the early pioneers and contributors as far as carotid artery intervention is concerned is Jacques Turon. Did you by any chance get in touch with him at any point of time to pursue that goal in carotid intervention?
Actually, we became friends and came to Milwaukee when we had the courses. And what he did was something I never wanted to do, but we both understood what we were doing. And the carotids was something he understood was going to be very, very important in endovascular therapy. But we just talked about things together from two different vantage points. He didn't know very much about coronary interventions, and those balloons and those things were very important. I didn't know anything about coil embolization, which I then went on to use outside the brain. And so we worked together. And once there was a dinner with Jacques Turon, Juan Perotti, and myself in my house in Milwaukee.
Yeah, I met him at his house in northern France, in Caen. He's a true gentleman and scientist as well. So we have to admire him for what he has contributed in that particular area. Now, maybe we should mention, and you know better than anybody, that when stenting started in carotids, right, and you were probably one of the first ones, you used what kind of stents at that point of time?
Well, it was not planned. There was a patient, and the patient was referred because of unremitting TIAs. He had a left internal carotid severe stenosis, occluded vertebrals, and right carotid. They asked me, nobody wanted to touch him. I said, fine, and we put him on the table. We went up, did the carotid, and the artery dissected. The patient was not doing very well, and so I then switched to using a guide catheter, put it into the carotid, and put in a peripheral, I think it was a 2020, Pamashat's 2020 stent, put it in, put it up to the carotid, opened it up, and the patient woke up. And I said, "Did you see anything? Anything happen?" He said, "No." But we had anesthesia there, and so the patient was fine and was discharged, but we didn't know how to deal with anticoagulation for the carotid at the time. But that's the first stent that was placed. And a similar episode occurred when I put in the first intracranial, which was a Hamashat stent for a similar patient from Florida who had a tear in the middle cerebral artery, put the stent in, opened it up, and Alejandro Bernstein said that he didn't believe I could do that, even though I showed the pictures at a meeting.
So, for the sake of historical detail, can you mention when was your first carotid angioplasty, and then when was your first carotid artery stenting?
I don't remember. It's in the 90s. That's all I can say, because Sri Iyer was there, and then Gary Rubin called me to ask about Sri, and I said, take him. And he went down, and they started the carotid program from there. And Sri taught Gary about doing peripheral angioplasty and carotid stenting.
Yeah, I recall it because you had an IRB protocol and institutional permission to do that, and we asked you if you can give us the same protocol so we could do the similar type of procedures in our institution. So I think your first carotid artery angioplasty was in 1990 and stent in 1991. That's my recollection. So this goes way back. Yeah, definitely.
That's probably true. I mean, more than likely true. I can barely remember my age anymore.
So let's move to another area of your interest. What fascinated me when in early 90s you were doing actually symposia or meetings in Milwaukee, and you were doing live demonstration cases, and you showed doing the procedures, those cases, that you were one of the first ones to create your own stent grafts, either with PTFE material or with a vein that was harvested, put it on either balloon or self-expandable stents. Is that correct?
Yeah, I mean, I was still alone, so to speak, in an environment which the companies wanted the medical school people to be involved. And apart from Simon Sturcher and Richard Myler, so I would sort of get into trouble sometimes or think about things that really were important. We had the Latecpa device, which helped me to understand about Dacron grafting and stent expanding and putting that in. And we had a patient who was a radiology staff mother who had a thoracoabdominal aneurysm. We put the stent graft in, the Latecpa with proximal distal stents. A few years later, she came back and had a twisted graft. I put a stent in the middle of now, and she recovered and never had any problems whatsoever. And then once we started to do that, I realized that you had to have material, PTFE, which we expanded and put into the superficial femoral artery or across various entities. But the most famous case for me is a man who had multiple bypass surgeries. He had unstable angina. He was in his mid-70s at the time, which is to me now young. And we did his right coronary, and the right coronary artery ruptured. We tried prolonged balloon inflation. That didn't help. And so I went out and spoke to the family and said I would harvest the cephalic vein and put it on a coronary stent. I secured it because I had surgical technique with sutures, put it into the coronary artery, got it in, opened it up, and it worked fine. It was great. It was one of the nicest cases I've ever done.
So it just shows you that your previous surgical skill from obstetrics and gynecology certainly helped you. Number one, to be brave enough to do those type of things. Number two, to have expertise. which was a great benefit to you. But another thing is like what you mentioned in a very humble way, is that success is achieved by going from failure to failure without losing enthusiasm. And that is absolutely true.
We had a symposium once, you and I, in Jackson, and Dr. Cooley was there, and he talked about carotid endarterectomy, and he showed a slide, which I never forgot, of him walking, a physician walking a long path along with multiple graves along that way, and being mistakes that he had endured. So I learned from that, but you have to be prepared. And Dr. Matur always taught me you have to think ahead. And Dr. Ayer will tell you that I always ask, if we have a complication, what are the ways you're going to get out? Not the first 5. I want to know 6, 7, 8, and 9, and 10. And that was very important to stay out of trouble. And we did that at the symposiums.
Tell us a little bit about your beginnings in EVAR. You know, the first one was performed by Juan Parodi in Argentina, which was the first EVAR in the Western Hemisphere on September 7, 1990. So how did you get involved in EVAR procedures?
I went to see Juan, and it was the same thing as when I went to Yugoslavia to learn how to do transeptals and do the double mitral valve balloon and valvuloplasty. So I went there, met Juan, we had a good time, and I set up a case to come back to the United States. But at the time, we only put in a stent graft that had a proximal stent on the graft. And then you had to figure out that that's not going to work, and you had to put a distal stent. So that was the beginning of where we worked. And Hector Baroni was with Juan Parodi at La Tech at the time, and that's what we did.
So, Jerry, another area of your interest, and again, Dr. Parodi was influential in making it happen, is working with him on a cerebral protection device. Can you mention a little bit about that?
Yeah, that was with Mark Bates, and we had developed a company, and that what he did was he said, if a subclavian artery occlusion can produce a subclavian steal, we can use that to protect by reversing flow into the carotid. And therefore there wouldn't be any embolization. And it was something that we worked on and did together. It was patented, and between Juan Parodi and Mark Bates, it moved forward. It was a very, very good idea from a company called Arteria.
Unfortunately, it doesn't exist anymore.
It doesn't exist anymore, and a lot of people were opposed to that. One of the things I think your audience should understand is that the people who really helped me were not all in cardiology or vascular surgery. When I was in OBGYN, Emanuel Friedman, who was a professor at the time at Harvard, had done work on plotting the labor curves. And I worked with him, and he showed me that collecting data was very, very important, not only for yourself, but to be honest in moving forward and making progress in medicine. So that was it. And the next person was a guy named Dr. Dennis Patient when I was a student in South Africa. And we were operating. I was first assisting. I had done some work, in the operating room. And he said, I'm going to leave you now. And the abdomen was open. He said, I'm going to take care of a patient who was gored, and the patient had leprosy. I said, what? And he asked me, can you close? And I said, yes. And he said, you have the capability? I said, yes. And so he taught me, to know what you were doing and be honest about it. And so those were the people who really helped me, as well as Dudley Johnson, who really made sure I collected data.
And finally, it would be unfair to talk about your medical career and not to talk about your achievements and activity in treatment of peripheral vascular disease, particularly in the lower extremities. And I'm talking about early 90s. This was almost like a no-no type of a intervention that was reserved exclusively to surgeons, and cardiologists would never allow to do, let's say, tibioperoneal intervention. So you were one of the first ones to start, in addition to Schwarten, doing those type of procedures. Can you mention a little bit obstacles that you had to go through and your results?
In February of 1979, I performed a popliteal using the contralateral approach, and we didn't have arterial sheaths at the time, and the surgeon, Bob Flemmer, opened the vessel for me. I said I could do that, but I didn't say that out loud. And then we went on, and we had people who had that. And I said, I can use coronary equipment. It's the same size. And collected the data, which was very, very important because the data was collected not by me, but by nursing staff who were totally independent about all of this. So we collected the data. And when I started to do that, Barry Katzen and Don Schwarten were not very happy with me not being an interventional cardiologist. And my brother is an interventional radiologist, and he was at the SCI VR meeting. And Barry Katzen put up my picture in front of all of these radiologists and said, I am the enemy. But it shows that, you could do a lot of things for below knee, and we salvaged many, many legs, prevented a lot of bad surgery to be done, and even said that if you can't go antegrade, you can make a small incision at the time in the dorsum of the foot and come retrograde, and we were able to do that all the time. So that has created a big change in the care of critical limb ischemia.
And eventually the radiologists accepted you as one of their own, because I know that you became an RSNI fellow, which is unheard of for any cardiologist. So I have to congratulate you on achieving that goal.
I applied multiple times. I was turned down quite a few times before I got to be a fellow.
Well, Jerry, we have heard quite a bit about your illustrious career in interventional cardiology. However, you have many other areas of interest, and one particular one that you are very proud of is in the animal world. Can you tell us a little bit about it?
When I moved to Wyoming, I wanted to learn how to ride a horse. I never had been on a horse until I was 60. And nobody wanted to teach me. I was too old. But a guy, Meldal, taught me how to ride a horse, which is not true. I was on a horse, but I wasn't really riding. And then eventually got involved in the cutting world, which is the most difficult sport I know because it involves a horse where you can't use the reins, a cow who's trying to get back to the herd, and you have no control over, and your job is just to stay on the horse. But I learned from that, and I want the people who may be watching to understand that when you leave cardiology, pick something to do. Pick something to learn that's going to be everyday learning more. And I studied to do that, and at the age of 79 in 2020, I won a world championship in Fort Worth, and that was pretty cool. I can tell you that.
Congratulations. I've seen those belt buckles. They are really impressive. Yeah. So you are definitely the only, not only living, but in history, interventional cardiologist that is a world champion in cutting horse competition. Anyhow.
That's true.
Well, Jerry, this has been a remarkable interview and podcast, and I cherish you as a dear friend for many decades. And thank you very much for the opportunity to participate with us in this podcast on Texas Heart Institute, Living Legends and Luminaries in Endovascular Medicine.
Thank you very much for inviting me.